Hi everyone, welcome back to NK Tips and welcome back to our weekly health tips series. So I want to say thank you to everyone that subscribed to the channel, everyone that promoted our videos one way or the other. I want to say that I'm grateful. And also to you, if you haven't subscribed yet, please try as much as possible to subscribe to the channel and turn on post notifications so that anytime I put up a video here, you'll be notified. Okay, so we are discussing another interesting topic today, which is diabetes. Yes, it's a very common health condition that most of us are very familiar with. Okay, so we want to use this opportunity to shed a little bit light on the condition. Okay, so diabetes is a growing global epidemic. All right, according to International Diabetes Federation, over 530 million people are currently living with the condition worldwide, and that number is expected to rise up to about 640 million by 2030. Okay, so this makes this condition a very important one to talk about. Okay, so in Africa, about 24 million adults are living with diabetes, and about two-thirds of this number do not even know that they are living with this condition. Okay, so it's very important that we raise awareness and see how best we can help people that are going through that situation. Okay, so diabetes simply is a long-term health condition that affects your body's ability to regulate your blood sugar. Okay, so normally what happens is that your pancreas produces a hormone called insulin, and insulin is responsible to regulate your blood sugar levels. Okay, so in the case of diabetes, this regulation mechanism is kind of compromised. It's either your body is not producing enough insulin, or there's some form of resistance to insulin, all right, by your body, so that your blood sugar levels remain higher in your bloodstream, okay, causing a lot of complications for you. So we have type 1 diabetes, which is an autoimmune disorder. Its onset is from childhood and adolescence. Yeah. So in this type of diabetes, your immune system tends to attack your pancreatic cells, making them unable to produce enough insulin that your body would need to regulate your blood sugar levels. Okay, and we have type 2 diabetes, which is hugely affected by our lifestyle, all right, hugely influenced by our lifestyle. In this type of diabetes, there's a form of insulin resistance, okay, by your body, or your body is not producing enough insulin that it will need to regulate your blood sugar levels. And also we have gestational diabetes, which happens in pregnant women. Okay, a pregnant woman tends to develop high sugar levels during pregnancy, and this type of diabetes usually passes after delivery. Okay, but then it puts this pregnant woman at risk of later developing diabetes. All right, so what are some of the warning signs and symptoms that you see that should give you a clue that probably you have high blood sugar, or probably you are diabetic? Okay, so a diabetic person would normally feel thirsty quickly. You easily feel thirsty and you urinate frequently. This is because the sugar levels are very high in your blood. Your kidney wants to come to the rescue by trying to get rid of the excess glucose in your bloodstream. All right, and by doing this, it produces a lot of waste products which you have to excrete through your urine. So whilst it does that, you have to be excreting a lot of times. So you tend to urinate a lot of times. And so once you keep urinating, it means that you easily feel thirsty, so that you can replenish the water that you've lost, all right, through urinating a lot of times. And secondly, you might also feel hungry easily. This is because the glucose that your body is getting from the food is not being put to use as it should. Okay, your body has to channel your blood glucose from your bloodstream to your blood cells to use as a form of energy. But in the case of diabetes, this is not going on. The glucose is still remaining in your bloodstream, so your cells are not getting the required energy from the food that you eat. Okay, so you feel hungry as though you haven't eaten. All right, so your body will prompt you that you have to eat, so that it kind of gets the energy that it's supposed to get from the food that you eat. Okay, and there's also subsequent weight loss because your body is not making use of the glucose that it gets from the food. Okay, there's constant tiredness and weakness. Okay, and then at advanced stages, people might experience blurred vision and frequent headaches. Okay, some people might also experience numbness or tingling in the hands or the feet, and some people might also have trouble healing from some wounds. Okay, wounds will take a longer time to heal. Okay, so when you see these things, you should take your mind to your blood sugar and try to check your blood sugar level. So let's look at some of the risk factors. What are some of the things that put you at risk of getting diabetes? So one thing is that if you are someone that is older than 40, you should be wary. You should regularly check your blood sugar levels because you are at risk of getting diabetes. So it was a case for some time, but now type 2 diabetes is increasingly being seen in people that are even younger than 40. Okay, yes, and also if you have a family history of diabetes, your chances of getting diabetes increases. So if your mother was diabetic, if your father was diabetic, if your uncle was diabetic, or if you have someone in your family line that was diabetic, you should be wary of your blood sugar levels. Okay, because the chance of you also developing diabetes is higher. Okay, and being overweight also puts you at risk. Okay, and also if you do not really exercise, if there's a lack of physical activity, okay, yeah, it puts you at risk of getting diabetes. And also if you always take diets that are high in sugar, and if you always take processed foods. Okay, in our sub region, most processing companies make use of high fructose corn syrup, which is a complex form of sugar. Okay, yes, so once you keep on taking those foods, you put yourself at risk of developing diabetes because these foods are very high in sugar. Okay, and also if you have a condition like high blood pressure, and if you have a condition like high cholesterol, okay, you are at risk of developing diabetes. And also, as I mentioned earlier, if you're a woman and then you have a history of gestational diabetes, your risk is very high. I mean, you can easily develop diabetes. Okay, so it is important that you know this risk so that you take precautionary measures. All right. Okay, so what are some of the complications if your blood sugar is not monitored? Okay, if your blood sugar is uncontrolled, what are some of the complications? So first thing we want to talk about is you are at a risk of having stroke and heart diseases. Okay, and then secondly, you may develop kidney damage because, as I explained earlier, your kidney is overworking itself to get rid of these glucose molecules. Okay, which shouldn't be the normal routine. And people may also encounter problems like eye problems, or at a later stage you might even go blind. Yeah, people go blind because of diabetes. Yes, so there's something that we call diabetic retinopathy. So if you get there, you might go blind. All right, so some people also experience damage to their nerves, okay, which causes that numbness and pain and maybe loss of sensation. All right, and as I mentioned, also poor wound healing. Okay, yes, so it is very important that we detect diabetes earlier so that we don't get into this situation. Okay, so let's look at prevention and management tips. All right, so it's very important that you take balanced diets, foods that are rich in vegetables, fruits, whole grains, and fiber. Okay, you also have to try to exercise regularly. All right, at least 30 minutes in a day. Try to exercise, especially if you are not doing a very active work, a work that demands you to walk around or stuff like that. Okay, you also should avoid the intake of foods that are high in carbohydrates or high in sugar. All right, avoid intake of soft drinks have a lot of sugars, okay, and also processed foods, as I explained earlier. You also should avoid smoking and limit alcohol intake, okay. And very important is that you have to go for regular medical checkups so that your blood sugar levels can be monitored, as well as your blood pressure levels and also probably your cholesterol levels. So we have to make it a habit of going for regular medical checkups. And in case if you are already diagnosed, you should strictly follow your doctor's advice and strictly take the medications you've been given. Some people might be on insulin injections, so you have to make sure that you are strictly following this regimen by your doctors, okay. So what you should do if you suspect diabetes, okay, if you see any of the signs that we have talked about, simply you have to get tested as early as possible. All right, a simple blood test can confirm that you have diabetes. All right, okay, there are some people that even have glucometers at home. If you are resourceful, if you can get your blood glucose monitor at home, it is recommended that you get it so that you regularly check it by yourself, even at home, okay. So this brings us to today's episode. All right, so diabetes is common and it's growing, okay, but it is not a death sentence. With early detection and changes and proper care, people that live with diabetes can live long and fulfilling lives, okay. So let's all commit to healthier choices and regular checkups to protect ourselves and our loved ones from dangers of diabetes. Okay, so if you found this video useful, please subscribe to the channel, like, comment, share with your friends so that we can reach maximum number of people as possible. Okay, so let's all stay safe and healthy. Remember that health is wealth. Goodbye, see you next week. Bye.